Aseptic practices are implemented preoperatively, intraoperatively, and postoperatively to minimize wound contamination. All members of the surgical team must be knowledgeable about aseptic technique and practice strict adherence to aseptic principles. It is the perioperative nurse who monitors the implementation of aseptic techniques by all surgical team members. This video and accompanying study guide will provide perioperative nurses and other healthcare professionals information regarding decontamination, disinfection, and the sterilization process. After completing this activity, the participant will be able to describe the process of preparing instruments for sterilization. Identify different sterilization methods. Discuss event-related sterility. Identify essential parameters of quality control for the sterilization process. The general goal of sterilization remains the same today as it did back in the late 1800s, when the idea of controlling the operating room environment first started to take precedence. Today's perioperative nurse has the responsibility of controlling the environment and providing quality care by ensuring that all surgical instruments are free of microorganisms and other contaminants that are capable of causing surgical site infections. As a means of preventing infection during any invasive procedure, AORN established recommended practices for basic aseptic technique and sterilization to serve as a guide for anyone who is either directly or indirectly involved with patient care. All personnel responsible and accountable for sterilizing items and handling sterile supplies must follow written policies and procedures. All basic procedures for cleaning, sterilizing, disinfecting, and maintaining the sterility of supplies are based on our knowledge of bacteria. Microorganisms are in the food we eat, the air we breathe, the water we drink, the ground we walk on, and on all things around us, including our bodies. Not all microorganisms are normally pathogenic or capable of causing disease. In fact, with most microorganisms, humankind generally enjoys a state of peaceful coexistence. The patient is a source of endogenous infection because of the large number of microorganisms found in the body. Attempts to control equipment sources of infection include cleaning, decontamination, sterilization, and disinfection. All supplies and instruments for use during the surgical procedure must be cleaned, decontaminated, and sterilized or disinfected prior to use. Decontamination is the first step toward reducing the potential hazards associated with direct contact with blood, fluids, or tissues on contaminated instruments. Decontamination refers to a process in which the bioburden is reduced and contaminants are removed either by hand cleaning or mechanical methods. Specific solutions and equipment are used to remove the blood and debris from the surface of an object or instrument, making them safe to handle. Once rendered safe for handling through a decontamination process, patient care items usually undergo a process of either disinfection or sterilization. The care and handling of surgical instruments should follow the recommendation of the manufacturer. Cleaning and decontamination begins the moment an instrument is used in the operating room, with the scrub person wiping the gross soil from the instrument with a sponge moistened with sterile water. Instruments should be kept free of gross soil during the surgical procedure. Instruments with lumens should be kept patent by irrigating them with sterile water. Stainless steel or other metal devices should never be soaked in saline. The chloride ions in saline will cause rapid corrosion of the metal. Initial decontamination of instruments should begin immediately after the completion of any invasive procedure. Instruments may be placed in a specially designed container for pre-soaking instruments. This container is filled with water and covered with a water-moistened towel. It is then placed in a plastic bag. Instruments may also be placed in a closed or covered cart for transport to the decontamination area. Cleaning is the single most important step in making a medical device ready for reuse. Debris on a device can interfere with its function or lead to a foreign body or pyrogen reaction in a patient if introduced into the body. The objectives in the cleaning process are: remove visible soil, including blood, tissue, and bone. Remove invisible soil such as microorganisms. Remove pyrogens. Prepare the surface of any item for sterilization or disinfection in order to allow direct contact with the agent and to protect the safety of the patients and personnel. Cleaning can be accomplished either by hand or mechanical methods. Regardless of the method, some basic principles hold true. The first step should be a cool water rinse to get rid of gross debris. Cool water will prevent the possibility of bioburden and/or contaminants from baking onto the item. If the device is heavily soiled with protein or fat, or if the soil has dried on, an enzyme detergent might be helpful as the step after the cool water rinse. Next, a detergent compatible with the materials in the device and suited for the type of soil is used. The device manufacturer should be consulted for recommendations for the type of detergent to be used. The primary soil in the sterile processing department is proteinaceous in nature. Coagulated protein may cover and protect bacteria from coming in contact with the sterilizing agent. Environmental controls and standard precautions can reduce personnel exposure to hazardous materials. Each employee working with contaminated goods must follow standard precautions required by the Occupational Safety and Health Administration based on the recommendations from the Centers for Disease Control and Prevention. Personal protective equipment should be worn in order to protect personnel from direct exposures to patients' blood, tissue, or body fluids. Personal protective equipment may include an impervious gown or long-sleeved apron, with cuffs that are completely covered by gloves long enough to prevent water from entering when the hands are submerged. Other essential protective equipment includes head and shoe covers, face shields or goggles, safety glasses, and a fluid-resistant mask. Each piece of personal protective equipment may be reusable or disposable. The decontamination area should be separate from the clean preparation area to prevent cross-contamination. If no division exists between the decontamination and clean areas, tasks should not be performed in each area at the same time. Environmental factors to be controlled in the decontamination area during the process include room temperature, humidity, and ventilation. Instruments cleaned manually are immersed and friction applied with a brush. Mechanical cleaning can be performed with one of several types of machines, including the ultrasonic unit or the washer sterilizer. The ultrasonic unit is not a sterilizer, and instruments should be cleaned and terminally sterilized before immersion in the ultrasonic cleaner. Washer decontaminators sterilizers can be single or multi-chamber tunnel units. Upon completion of the programmed cycle, the instruments are rendered safe for handling. Washer sterilizers wash instruments or other devices, rinse them, and then go through a gravity steam sterilization process, usually at 270 degrees Fahrenheit. The instruments are not considered prepared for subsequent use. Regardless of the method chosen to clean the instruments, all items with detachable parts that can be separated need to be disassembled for cleaning, packaging, and sterilization. Decontamination is the critical step in breaking the chain of cross-infection between patient and between patient and worker. Sterilization cannot be achieved if items are not thoroughly cleaned of the protein soil. After the cleaning and decontamination process, items should be prepared and packaged so sterility can be achieved and maintained to the point of use. An important step in the packaging phase is the inspection of each item and the packaging materials. To be effective, the sterilizing agent must come in contact with all surfaces of every instrument. Instruments should be arranged in sets and placed in a tray with a mesh or perforated bottom or specifically designed container that permits the penetration of the sterilizing agents and prevents trapping of air. A towel or other absorbent material may be placed in the bottom of the tray to help absorb condensation that is formed during sterilization and help speed the drying process. All instrument joints and hinges must be opened to ensure contact with the sterilizing agent. All instruments with detachable parts must be disassembled. Heavier instruments are placed on the bottom so they do not damage delicate instruments. Tip protectors made of permeable material can be used on sharp instruments. An absorbent towel or other porous material must separate items such as basins and medicine cups that are nested. This allows for steam contact with all surfaces. The next step is preparing items for packaging. Packaging materials must be compatible with the sterilization process. Packaging materials may be woven or non-woven material. Peel packs of plastic and/or paper, or rigid container systems. If the sterility of an item is to be considered event-related, the packaging material should be strong enough to maintain its integrity following the sterilization process and protect the item from contamination. Plastic dust covers also can be used to further protect contents. Sterilization is defined as the process by which all forms of microbial life, including bacteria, viruses, spores, and fungi, are destroyed to an acceptable sterility assurance level. Sterilization methods include thermal, chemical, and radiation. The first method of thermal sterilization is steam under pressure. Steam at atmospheric pressure is incapable of sterilizing an item. When steam is placed under pressure, its temperature rises, and the moist heat produced destroys the protein within the cell, rendering it harmless. Direct contact with the steam is required to ensure sterility. Steam under pressure is still the most commonly used and economical method of sterilization of heat-tolerant items used in the operating room. It is easily supplied and controlled. Steam does not leave any toxic residue. The type of steam sterilizer is defined by the method of air removal it uses. The two types of steam sterilizers are the gravity displacement and pre-vacuum sterilizer. Flash sterilization will also be described. Gravity displacement sterilizers rely on gravity to remove air, which is heavier than steam. Steam and air do not mix well, therefore a layer of steam forms above the air. As more steam is introduced, the space in the chamber decreases and the air exits down the drain at the bottom of the sterilizer. Pre-vacuum sterilizers are similar to gravity displacement sterilizers, except that they are fitted with a vacuum pump to ensure that air is removed from the sterilizing chamber and from the load before the steam is injected. A pre-vacuum sterilizer is considered more efficient in removing air than the gravity sterilizer. There are 4 parameters that affect the steam sterilization process: steam saturation, pressure, temperature, time. Steam sterilized items must be allowed to cool thoroughly before handling or removing from the sterilizer cart. Items might still contain steam vapor and condensation. If handled, there is a potential for compromising the barrier properties of the packing materials. Flash or high-speed sterilizers may have either a gravity displacement or a pre-vacuum cycle and steam sterilized between 270 and 275 degrees by the unwrapped method. The flash method should only be used during urgent, unplanned, emergency situations, or when the surgical suite has been specifically designed to incorporate flash sterilization of instrumentation. Flash sterilization should not be used for routine sterilization of complete instrument sets.
Yes.
There is now a commercially available portable flash sterilization unit. Dry heat sterilization is used primarily to sterilize anhydrous items that can withstand high temperatures, such as anhydrous oils, petroleum products, and talcum powder that steam and ethylene oxide gas cannot penetrate. In the absence of moisture, higher temperatures are required in order to destroy microorganisms through a very slow process of heat absorption by conduction. The most efficient and reliable dry heat sterilizer is an electrically heated mechanical convection hot air oven. A blower forces hot air in motion around items in the load to hasten the heating of substances and to ensure uniform temperature in all areas of the oven. The most common safety hazard associated with dry heat sterilization is burn injuries from touching the surfaces of the hot sterilizers or items. Operators should use protective equipment, and packages should be cooled before being handled or removed from the dry heat sterilizer. For critical items that are heat sensitive and that can be immersed, the FDA has approved chemical sterilants as a method of sterilization. These chemical sterilants include peracetic acid, low-temperature gas plasma, and ethylene oxide. Peracetic acid is a liquid chemical sterilization method that uses low temperature of 122 to 131.9 degrees Fahrenheit and is equal in efficacy to steam and ethylene oxide sterilization. It requires the use of a special unit designed for this type of sterilization. All items and internal components must be completely submerged in the heated solution. When the sterilizing cycle is complete, the processed items are rinsed 4 times with sterile water, provided by tap water that is passed through a membrane filter. An internal self-diagnostic and monitoring system produces a printed document confirming that all sterilization parameters have been met during each cycle. Peracetic acid is an effective sterilizing agent that does not leave toxic residues on sterilized items when items are rinsed properly, but may cause serious injury if not handled, neutralized, and rinsed properly. Since items sterilized by this method are wet, they should be used immediately and cannot be stored. Plasma is the fourth state of matter distinguishable from a solid, liquid, or gas, which can be produced through either a strong electric or magnetic field and consists of a cloud of ions, electrons, and neutron particles. The process begins with injection of hydrogen peroxide and water into a vacuum chamber. An aqueous solution of hydrogen peroxide is vaporized in the chamber surrounding the items to be sterilized. Then a radiofrequency-induced electrical field accelerates electrons and other particles that collide with each other, creating a plasma cloud. The plasma cloud interferes with the cell membranes, enzymes, and nucleic acids to disrupt life functions of microorganisms. Low-temperature gas plasma sterilization methods may be used for moisture-stable, moisture-sensitive, and heat-sensitive items. Ethylene oxide is a colorless, flammable, explosive gas that is commonly used to sterilize heat and moisture-sensitive items. It is also a carcinogen and mutagen. It is extremely hazardous when inhaled or when it comes into contact with the eyes or skin. Ethylene oxide kills microorganisms including spores, molds, yeast, and viruses by interfering with the normal metabolism of protein and the reproductive processes, and must have direct contact with microorganisms in and on the items. Ethylene oxide sterilization is dependent on 4 parameters: gas concentration, temperature of 37 to 63 degrees centigrade, chamber humidity of 45 to 75%, and time of 2 to 5 hours. Failure of any of these variables affects the probability of achieving sterilization. Radiation sterilization is discussed in the accompanying study guide. Shelf life is defined as the period of time that sterility is generally maintained and is related to the capability of the packaging material and the storage conditions to protect the sterility of the packaged item. Shelf life should be considered event-related, not time-related. The number of times a package is handled can affect the package integrity. Sterilized packages should be inspected for breaks, rips, holes, and for intact seals and proper labeling. Transportation procedures for sterile items can help prevent damages and preserve the quality and integrity until the time of use. Sterile items should be transported in covered or enclosed carts with solid bottom shelves. Storage areas must be kept clean and free of dust, lint, dirt, and vermin. Sterilized packages must be stored under conditions that protect them from extremes of temperature and humidity. Monitoring and measuring process control is a required component of the quality control program. The quality control parameters include sterilizer maintenance history, sterilization process monitoring by biological, chemical, and mechanical devices, air removal testing of pre-vacuum steam sterilizers, visual inspection of packaging materials, lot control and tractability of load contents, documentation, function tests. Proper inspection and cleaning minimizes sterilizer downtime and helps prevent sterilizer malfunctions. Maintenance records should be kept for each sterilizer to ensure safe operation. A sterilization process indicator should be placed on the inside of every package that will be sterilized. Either the internal or external process indicator should be clearly visible before the package is opened and placed on the sterile field. The purpose of the external process indicator is to differentiate between processed and non-processed items. An air removal test should be performed daily in a pre-vacuum sterilization cycle. The air removal test is designed to detect residual air in the sterilizer chamber. Each sterilized item should have a lot control number imprinted to identify the sterilizer, cycle, or load number, and the date of sterilization. Documentation for every wrapped or unwrapped sterilization cycle should include results of routine biological monitoring of sterilizers. Today, the options for sterilization of surgical items are more varied than ever. Sterilization still provides the highest level of quality care and assurance. The sterilization process is complex and multifaceted. The perioperative nurse's understanding of the process is vital to its success in order to ensure safe and effective care of the patient.